with the North Central Regional Center for Rural Development, and we're pleased to be hosting this webinar from Dr. Wilson Magee, Dr. Joanna Reed Adams, Beverly Maltzberger, and Letitia Johnson, all with the University of Missouri. So with that, I think I'll turn it over to our presenters.
Well, welcome. This is Dr. Joanna Reed Adams with Wilson Magee here in my office, and we're going to kick it off with a good afternoon to everyone, and welcome to the Extension and the Intersection of Community Development and Health Promotion webinar, being presented by those that Scott already mentioned, Dr. Wilson Magee, Beverly Maltzberger, Letitia Johnson, and myself, Dr. Joanna Reed Adams. We represent University of Missouri Extension and the MU School of Health Professions, so this is a collaborative effort. Today's seminar was made possible by the North Central Regional Center for Rural Development. As part of the introduction, I need to remember to proceed with the slide. The delivery of programs and services is fragmented, and there is a growing disparity in health indicators. A lack of coordination may be the culprit. We looked at 4 cases where Extension served as the hub for community development activity. And we're going to show you this afternoon through our paper we wrote based on the research why Extension may be the most suitable for serving as a hub for collaboration.
Sorry, I always forget that mute the mic button. This is Tish Johnson, and I don't want to go into a lot of details about healthcare disparities. I think you can look that information up. We did look at, there is some information out there, the national data from the Agency for Healthcare Research and Quality within the U.S. Department of Health and Human Services. There is national data available for 2013 and state profiles for 2012 and earlier. Just the point here is primarily that there are healthcare disparities, and they differ by age, they differ by ethnic group. For example, the 2013 national report notes that there are some significant gaps for people of Asian and Pacific Islander ancestry. In Missouri here, we have a lot of, not surprising in some ways, given everybody knows that I think about the obesity epidemic in the Midwest in general, you know, diabetes, for example, particularly in children, hypertension, asthma, and just managing chronic conditions. These are not just individual issues. These are community issues. These are environmental issues. These are economic issues as well. So it was this ongoing and growing disparities that was one of our motivating factors for looking at how Extension works in communities now.
And to give you a little bit of context of the research in the paper, we talk about on this slide, and you can take a look at this as I'm giving some details, challenges for community development as well as challenges for health promotion. The World Health Organization defines health promotion as the process of enabling people to increase control over and to improve their health. This implies that health promotion goes beyond a focus on individual behavior to include a wide range of social, economic, and environmental interventions. The term community development in this paper is used loosely to refer to efforts to improve the physical, economic, and social environment by promoting a variety of programs such as job creation, small businesses, affordable housing, community infrastructure improvements, training and technical assistance, and supportive social services in low-income communities. There's also challenges for cooperative extension nationwide, such as decreased funding that we're all, like most of us, are experiencing. And also, although there remain approximately, we found in our research, 2,900 extension offices nationwide, the number of local extension offices has declined over the years. Several reasons account for this decline. Introduction of extension districts, closures, huge federal, state, and local government budget cuts, increased competition from other players, and lack of awareness about extension by the general public, or misunderstandings about what extension is and isn't. This next slide is a quote taken from our paper, and it says, if health promotion and community development are fighting closely related battles, why has the war on disparities been so difficult to win? Could a lack of program coordination between different community development and health promotion entities be the culprit? We hope you ponder on that as we continue our first 20 minutes here, and write your questions in the chat. We talked about a proposed strategy in our paper. The goals of the paper are to argue for the interprofessional and interorganizational collaboration between and among individuals and groups involved in community development and health promotion at local levels, and two, suggest that cooperative extension can take the lead in promoting these collaborations. In order to make the case of the key role cooperative extension can play in promoting interorganizational collaboration, this paper purposely uses a multiple case study approach. Step Up to Leadership was the first case, or one of the studies that we did. This program was a partnership with University of Missouri Extension and the Missouri Association of Community Action. It's a 12-week program designed to build capacity in constituents of community action agency programs primarily, and civic engagement, increased civic engagement in communities by people serving on boards and doing community projects, etc. It's been a very successful partnership. Step Up to Leadership has over 6,500 participant manuals. This is a curriculum. Have been sold across the U.S. and internationally. Again, each session is about 3 hours. There's assigned homework. Usually there's around 20 per class. And the picture in this slide is of a community garden that was started as a result of one of the programs. One of the key components of the Step Up to Leadership program is doing a community project. Okay, I had to double check that slide was mine, and it is. So these are some study results of the Northwest Missouri Step Up to Leadership graduates, and this is something that we're very proud of. The components of Step Up to Leadership that are critical in building community leaders in rural and poor communities. These are usually low-income individuals that participate in the program. It allows people to see other viewpoints. They get to understand and be exposed to different value systems. It helps folks alleviate their fear and unwillingness to take up leadership roles, which we all know we have a deficit of those willing to take up those roles in our communities. There's an opportunity to help community members empower themselves to influence the decision-making processes, ability to foster the development of social capital, which is very important, and it demonstrates a beneficial influence on both of its graduates and on their community. Okay, we also are involved with the North Central Regional Center for Rural Development Small Grants Program. Wilson and I are related to the Step Up to Leadership program. We're doing an evaluation of that program in Illinois and Missouri. And you can take a look there at how we're structuring that research. It's a mixed method analysis. We're looking at the impact of the program on participants' leadership skills and strengthening communities' economic development. There are data is being obtained from participant surveys, document reviews, and in-depth interviews, which has been very insightful. We're right in the throes of that at this time. And the major goals you can see there demonstrate that Step Up to Leadership has an impact on the participants and their communities. Collaborative initiatives between the states and organizations hold promise in producing sustainable rural development. Use the data to redesign the program to better meet the needs of communities and facilitate collaboration and other states.
And Kristen Kleinjohns had a question about basically how did you conduct the needs assessment, or was there needs assessments done? Paraphrasing there, you can see the question in the chat.
Initially, those topics or skills were developed by by a key stakeholder group in the urban and rural areas that helped us develop those session topics. That gets at what you are asking. Wilson wants to say something.
Yes, there was some community needs assessment done by the Missouri Community Action Agency prior to delivering the program.
Okay.
Okay, our second case study that we looked at is that of Leadership Northwest Missouri, and it is a regional leadership program that includes participants from the 16 counties in the very northwest corner of Missouri. This concept of looking at regional leadership started in 1999, and the first regional leadership graduate, the class graduated in 2001. Sessions rotate throughout the region. They're not all at the same location, so it gives the other counties and the region an opportunity to learn more about other resources within the region. Sessions last for 1 day, and they meet once a month, January through June. Now, prior to this particular program, Extension had conducted several community and county level leadership programs using the EXCEL model, which EXCEL stands for Experience in Community Enterprise and Leadership. This model was used for the origins of Leadership Northwest Missouri, with Extension providing the leadership in organization as well as curriculum development and board development and training. Our overall goal, as you can see, was to develop leaders who could actually see that bigger picture of regional networking and regional development, in that if it's good for one county in the region, then it helps the entire region to become better economically. Today, the leadership program is very successful, and it has a broad base of regional leaders who are accomplishing many goals as a regional team. We have approximately 300 graduates out within the region who are working and recruiting others to be a participant and work as a team. Just as a review, the Extension roles in this, again, we're working with community leaders in their organizational development, board training, curriculum development, establishing their 501c3 status, and of course evaluating the program. You can see some of the results and comments from our graduates. Excuse me. In this example, leadership and healthcare did come together to help address a major rural healthcare need. The alumni and regional leadership participate in an event called Great Northwest Day at the Capitol. Graduates from all leadership classes and regional leaders get together in February to share information with legislators and advocate for specific projects that are needed within the Northwest region. It's an outstanding networking and information sharing event. You can actually learn more about this particular event. Wilson and I did a webinar previously on this on February 10th, and that would be registered. Scott could give you more information about that. Okay, the third example is the Community Cultural Diversity Committee, which consists of local agencies and resource providers, as well as support of the Mexican Consulate in Kansas City and the Extension Alianzas project at the University of Missouri Kansas City Institute of Human Development. Extension serves as the facilitator for the Cultural Diversity Committee, as well as the Binational Health Fair, which is one of the projects of the committee. The Health Fair is officially sponsored by the Cultural Diversity Committee and partnering agencies. Cultural Diversity Committee has been operating for about 10 years and has over 100 agency and faith-based groups in their contacts list. Excuse me. This has developed a very strong network across the community, which has allowed us to coordinate our efforts and really focus on a major event. As the extension facilitator, I also maintain the mail list for the various groups, and this allows Extension to also provide very timely information to the entire group and share important events or announcements relating to the overall committee, as well as the targeted Hispanic audience that we are working with. The Binational Health Fair is the major annual event sponsored by the Cultural Diversity Committee. Now, as I said, Extension serves as the facilitator and organizer and general point of contact for the agencies in organizing the health fair. All member agencies participating in the planning process, as well as providing exhibits and health screenings, are involved very intimately with this project. The Extension Alianzas project interviews participants each year to collect general health information from them and provide an evaluation for the event back to the partners, so we know where we are and if we have reached our intended audience and met the needs that they might have. In Missouri, 42% of the Hispanic population is under age 20, while the non-Hispanic population under age 20 accounts for just 26% of the population. And again, this is from the Missouri Foundations for Health in their April 13th publication. We continue to recruit cultural diversity community partners. We have added staff and students from the School of Nursing and Physical Therapy at our local university here in St. Joseph. They provide assistance with screenings and really add a new dimension to our volunteer base so that we can really serve more clients more fully. We have bilingual interpreters that are on site to assist families as they move through the various screening stations and publications that are available in Spanish and English. I believe Extension is the right agency to serve as the catalyst to linking families with community resources. All citizens in the overall community, all of our citizens in the overall community benefit when health screenings can identify potential health problems of new immigrants into the community and refugees so that they can be addressed early and don't become a major health concern. This reduces the cost of health care within the community, and it results in overall in a healthier community by doing the screenings early. So again, the roles that Extension plays in this particular project include facilitating the Cultural Diversity Committee, sharing timely and important information with the other agencies, program development, community points of contact, and at the health fair, the coordination, setting up of educational displays and organizing the fair, evaluating, facilitating, and as I said, being that point of contact within the community to get information out.
So our fourth case study that we looked at was the Mississippi River Hills region. It's a little different than the other three. This is a regional, a 6-county rural development initiative that focuses on the unique attributes and assets of that region, on connecting and developing and promoting those assets. Now, this initiative began with on campus with a rural sociologist who did not have an extension appointment, so it was separate from us initially. Elizabeth Barham, who's now with Arkansas, she studies the concept of terroir, which I believe literally translates to a taste of place, and labels of origin, geographic indications is its more fancier title, if you will. She sort of conceived that what if we took the European concept of terroir and applied that in the U.S., starting here in Missouri, because that's where she was located at the time. So for numerous reasons, she selected these 6 counties as the pilot site, and at that point began engaging with Extension. Our initial role was really as a facilitator. As you can imagine, 6 counties here in Missouri, this was about 90 miles long. Mostly rural counties. Cape Girardeau is our largest municipality within those 6 counties. And so over time, it really has evolved to sort of this 3-legged stool with this buy local campaign, entrepreneurship support, whether that's people who are looking to start a business, diversify, or just fix an ongoing business, and then regional food system development. So there's been a lot of pieces and parts to this. There's a regional association that was officially formed in 2007, and it was Extension sort of incubated the startup of the association and the project. They're now completely independent, and but we work closely together. We have more of a support role now, Extension does, which is how it should be, I believe. We worked with this project, Extension, in multiple ways. We were the hub. We were building linkages between these networks, between stakeholder groups. I remember our earliest meetings when we had small-scale farmers in the same room as restaurateurs and people who owned hotels and local government people, and everybody's kind of clustering around just talking to their own people. It's kind of awkwardly not knowing how to talk to each other. And now they come and go very easily, and they communicate quite well between them and without us, which is great. One of the examples I wanted to mention that what we brought to the table was in terms of our partnerships and networks, is we worked with our region was divided between 2 congressional districts, one Republican, one Democrat, and we worked with them on securing, we'll call it a grant, it was an earmark, we'll call it what it was, from the Small Business Administration that really financed the startup of this project, providing monies for marketing, for workshops and educational programming, and it also financed a part-time staff person. Our initial goal was to have that individual be actually employed by the association to contract that out, but the SBA wouldn't let us do that. So that individual was technically an Extension employee, but she did not work directly in this office. She worked with the association. She worked with that board of directors. We pulled her in now and then and made her wear an Extension hat every now and then, but for the most part she worked directly with the association. And how's that been going? It's gone pretty well. That model has been duplicated in 3 other regions of Missouri. Each one's a little different. These regions stretch across the width of Missouri along the Missouri River from just west of St. Louis, St. Charles, all the way to just the east side of Kansas City. We've done very well in terms of tourism in the region. It's gone up, added a few jobs. The powers that be like to talk about the number of jobs that are added. I happen to think it has to be more about the quality of the jobs, but that's another conversation. Been a number of startups, very pleased to see some dormant businesses purchased and reopened. Those happen to both be agritourism operations. One was a winery and the other was a U-Pick blueberry operation. A number of businesses have expanded. By expanded, I mean they have added significant expansion, like adding physical space, building a second operation, that sort of thing. We've had some good publicity. Some of our partnerships are not just external, but internal within the university, non-extension. So, for example, we've been working with the folk arts department, and that led to us being at the Smithsonian Folklife Festival for 2 weeks in 2012. It's a 2-week festival in July. Sorry, we were there over the 4th of July, and it was really great to showcase what we do here in this region, as well as what the university does in general to support healthy foods. But 2 weeks in Washington, D.C. is not too shabby for us. So what all these have in common is really about this capacity building. It's about the empowerment of community members and the recognition that they are the local experts. Each one of these is tapped into and intermingles both internal, external resources to address the issues that are specific to that community. That's one of our advantages. By having extension embedded in the community, that's a role that we can play. Each one of these programs has benefited from and takes advantage of our access to a wide range of resources and expertise, to our networks, whether they are local, statewide, national, even international, and the partnerships that we have. We know that our initiatives are the most successful when we have community members involved in the full spectrum. They identify the problem, they are active in deciding how we're going to address the issue, and in evaluating the impact and how we go forward. The Mississippi River Hills Project, for example, like anything else I've ever done, did not end up where I thought it would. Nothing ever ends up where I think it will go because I'm not the one charting the course. So these are our conclusions, and that if we don't have coordinated collaborative program delivery, can actually be harmful to both our program providers and our beneficiaries. By having things fragmented, it just doesn't work well for anyone. Collaboration obviously provides a mechanism for enabling stakeholders at all levels to leverage those resources and eliminate duplication. We want to avoid the gaps, and we want to avoid the overlap as well. And we believe, the four of us believe, that with extension in every state, with its existing structures, its networks, its partnerships and resources, that we may be the best suited to be the hub for collaboration going forward to address health disparities and healthcare disparities.
We've got 3 implications that we want to just kind of close with today, in addition to some final thoughts and thanks from Wilson. Extension programs lead to empowerment of community members, which leads to community development and health outcomes. And you can see there that there are some implications that possibly could occur and do occur. Increased awareness of extension resources, a stronger extension capacity to serve a growing and increasingly diverse constituency, and a rationale for continued and increased financial support.
In closing, I would want to re-emphasize the In closing, I would want to re-emphasize the potential that lies within Extension to be the leader in building and coordinating collaborative community development and health promoting programs. Although times are hard, Extension can still be the beacon in creating lasting change in our communities. Our strength in the range and quality of our programs, our networks, and our local presence must not be understated. Thank you very much for your participation. We can take questions.
Thanks for a good romp through several very interesting case studies at the nexus between community development and health. It's great to think about these issues. I think a lot of what you're talking about is kind of the bridging between community development and healthcare systems outside of extension. What about the whole question of better coordination across community development folks and people that are doing programming in health within extension? Have you thought about that at all?
Joanna, you want to try that one?
Tish, I'll take a shot at that. With our Binational Health Fair, we are very much involved with our local health departments. We also have another healthcare provider that partners with the Mexican consulate to provide services for Mexicans abroad who come here with some form of health insurance. We've also worked with the Region 7 Office of Minority Health. So even though we didn't state it previously, we are very involved with healthcare at all levels to try and bring as many resources to the table as possible. Our local health department provides immunizations during our Binational Health Fair, and that has been a real plus. They also work with the school district to identify children at the health fair who are in need of specific immunizations in order to enter school. So even though we didn't mention it, we are very much working with and coordinating those efforts with our local and state health agencies.
My question was more internal. So what about coordinating with family and consumer sciences folks, for example, from Extension?
Well, this is Tish. I didn't mention this either in the interest of time, but I do work very closely with other categories, if you will, other program areas. In Missouri, we divide up our CED program, our Community Economic Development Program, into two pieces, business development and community development. I work very closely with my business development colleague. He's 2 counties south of me, but also regional, and to some extent with the agriculture folks. We have worked some with the HES colleagues. They haven't been as interested in the Mississippi River Hills Project, but we have collaborated on some events. For example, when I mentioned the Smithsonian Folklife Festival, we collaborated with them quite heavily on that, as well as the Folk Arts Department.
Okay, thanks. And I think you addressed a little bit Scott Chasden's question about the state health officials. Christian had another question here. From a community-wide point of view, what level of management do you feel provides the most effective leadership when dealing with maybe NGOs of varying sizes? I'm going to try that one. And by the way, I put up the evaluation, so if folks could be looking at that and clicking through those as well while we talk, that would be good.
This is Tish. I'll answer Christian's question and then everybody can jump in, but I want to back up a minute to Scott Chasden's question. In Missouri, our Department of Public Health is very localized. There's local funding that goes into local health departments, and I work pretty closely with the ones in my area, but it is a challenge. And for example, the Missouri Food Code is, the state will tell me that the code's the code and everybody interprets it the same. The farmers will tell me something very different. So it's been a bit of a challenge. They'll say, why do I have to do this in this county and I don't have to do it in this county? So one of the things we did is, and we're getting ready to do again, is we did a panel discussion with food producers and health department sanitarians, the people responsible for enforcing the food code. It's kind of one of those things I can't believe nobody had thought of doing before, and it was such an easy thing for me to do as an extension person, and it was remarkably productive. It's crazy that these people hadn't talked to each other and asked some very, very basic questions in trying to understand each other. Working on the state level with the Department of Health, I haven't really tried that yet, but I'll see if any of my colleagues wants to jump in on that part.
And I might just add a couple notes. You asked about working with colleagues. Our family financial planning specialists, as well as our nutrition and health education specialists, also participate in the Binational Health Fair. We do some food tasting of local foods, which some of the new immigrants are not familiar with, so encouraging them how to prepare some of the local foods and the health benefits that those local foods have. And then just the whole family financial planning aspect. Many of these people, this is the best job they've had in their entire life, and they think they're rich, even though they're making $15,000 a year, which is barely scraping by in this part of the country. So a lot of them do get into some financial problems. We also work with our housing specialist, talking about the difference between renting and buying a home. Many of them were under the impression that if they're renting a home, then they're also in the process of buying it. So that type of information is also provided as secondary information at the health fair to, again, try and connect them with a broader array of community resources.
And Michael Darger had a question that he put up in the chat, and so I just turned it into a poll so people could be answering that more generally. I guess probably the question was directed at the presentation team, but I thought it would be interesting to see what the group thought as well, so I quickly put that up.
With regards to Christian's question, I'm not sure I fully understand your question, so you might correct me, but in terms of the level of management that might be most effective for working with nonprofit organizations, I think local is good. Somebody that's got local credibility. Now that person may be, and that's going to vary by community, and the definition of community is going to vary. Community may be one municipality, it may be a county, it may be more than one county. So I think that's a little bit of a specialized, it's kind of hard to generalize. What would be the answer there?
And then Mary Simon Lucy had a comment, I believe, was just about coordinating with health on, and so that's a good positive initiative she's talking about of sending regional specialists to participate in State Department of Health planning and training.
Sure. I mean, the Department of Health is, as any state agency, is certainly a valued partner that Extension works with. We were just referring with these specific projects. Leave it to Mary to correct me. She's always right. She knows it all. And we're glad.
This is Joanna. I might just add to that question that with the Step Up to Leadership, that whole project and developing that curriculum and program was done with the statewide nonprofit of community action agencies. So we did, of course, work with them from the beginning on that project.
Does anyone on the team wish to comment on Roberta's comment, saying that the people outside of the system look to the extension model as a way to do this, and then sometimes we're trying to figure it out, having a hard time figuring out our work internally?
This is Tish. Over about the last, I'd say 7 years, there have been several different types of partnerships and discussions that have gone on between some aspect of the MU Med School and Extension. There have been some very productive initiatives that have come out of that, and I don't know if Mary Lucy wants to jump in and comment on any of those. The One Health, One Community, Mary, is one thing I was thinking about. And Wilson, you know about more of those.
And Ella Rausch has an opportunity for people to provide some input to a project that is going on with the Federal Reserve Bank of Minneapolis and the R.W. Johnson Foundation. So feel free to click in on that, or copy and paste that into your
Scott, I'd like
browser.
to make a quick comment here too. I think that it's a really good partnership because medical people tend to be very technical and very detailed, whereas extension people have that local connection. They have broad networks within the communities. So with the two working together, you can bring that technical information in, but yet you can provide it to people on a community level and help them with the understanding of how these various aspects of health impact their lives. For example, we do diabetes screening, and the local health clinic takes care of that with the students from the university helping, and then our nutrition person comes along and talks with them about the different kinds of foods they're eating and how they can improve their diets. So I think it's really a nice flow from looking at what a potential problem might be strictly from a health standpoint to looking at things that they can do, the education that we can provide to help them impact the decisions they make to improve their health instead of allowing it to deteriorate.
Great point. I am not sure we're seeing any more questions. It's been an interesting and thought-provoking webinar. If you haven't filled out the webinar evaluation, please do so that our presenters can get some feedback. And this will be archived at the spot mentioned there at the bottom. So I want to thank everybody for being on board, and in particular our presenters for doing this.